Welcome to Chapter 5 of Ethics. Today we're talking about boundaries. With boundaries, note that they are one of the most important dimensions of the practice of massage therapy and body work. Also, what exactly are boundaries? The word itself is often used to describe or used in two different ways. First, there's personal boundaries between you and the client, and then there's the boundaries that involves limits of behavior. Often massage therapy, both meanings of boundaries are present at the same time. For example, the issue of a boundary issue occurs if a therapist touches a client in a sexual way, because the therapist has crossed a boundary between self and the client and has also crossed a line from acceptable to unacceptable behaviors. Laws, rules, and regulations define many necessary boundaries, such as our sexual boundaries and our physical boundaries. In other areas, however, boundaries are not always so clear-cut, and there's no simple set of rules that everyone in the profession follows. New and experienced practitioners can have difficulty defining and understanding where exactly the boundaries are, and it's often challenging for new practitioners to know exactly where the lines need to be drawn. This course hopefully will kind of help you understand that, but again, still, it kind of just comes down to practice, experience, those types of things to really define it. But the course itself is designed to kind of help you really fast forward a lot of that to be able to have those expectations and know what those limits are. In the therapeutic relationship, a therapist also cannot always know precisely what the client may view as acceptable or unacceptable. So you can't really know if you're crossing a boundary if you don't really know what they consider to be acceptable or unacceptable. So you establish your own general guidelines, and discussing and defining them individually with each of your clients seems to take a great deal of energy, but it's important to do that so that the client knows what you expect, and also so you get feedback and know kind of what the client expects. The importance of boundaries. There's several different types of boundaries in the therapist-client relationship. We have the physical boundaries. They involve issues such as draping, what areas of the body should or should not be worked on, and the types of work performed. Then you have the emotional boundaries. This is between the client and the therapist. Elliot Green and Barbara Goodrich Dunn write The Psychology of the Body, which is our psychology textbook that we will be using. It states that boundaries of behavior serve to facilitate the therapeutic process, client safety, and protect the integrity of the client as well as the therapist. The therapist and client should agree where appropriate boundaries lie in bodywork relationship. From the time you enter the professional relationship with a new client, the client should expect you to maintain a parameter of that relationship. Yet often the professional relationship can begin without clear definitions of the parameters or the boundaries that both parties feel are acceptable. To help prevent this potential problem, some therapists include a brief section in their intake form that states their scope of practice, and other therapists ask new clients to read their written policies before sessions begin. These are ways therapists can describe their boundaries for the clients, but clients too come into the professional relationship with their own expectations regarding physical and professional boundaries, and it's similarly just as important for the therapist to know what these expectations are, as well as them knowing what your expectations are. So the next topic is defining boundaries. So boundaries are based on guidelines that help you to maintain a professional image for your clients and others in the profession. You want to establish and maintain your own exact boundaries. It's an important part or important step in the massage and bodywork practice. Still, most therapists eventually are faced with unanticipated situations or situations in which the usual rules don't seem to apply. In situations like this, you may need to be somewhat flexible while remaining strong within your beliefs and your foundations. Again, we talked about the Code of Ethics being a living article or living document. Means it changes from time to time, so be prepared. Know that going into this, once you write your code and you set your boundaries, that sometimes you have to kind of change those a little bit as you go along based on the situation, but ultimately you stay strong and you stay true to yourself, your ethics, your values and morals, as well as your boundaries. So boundaries help set the parameters for your practice. They also help you assure your clients are in a safe environment. Some boundaries may be defined by laws, rules, or regulations, such as the sexual and physical boundaries, whereas others, such as the emotional boundaries, and social boundaries typically aren't defined by laws and rules. When boundaries are not clearly defined by laws or a governing body or association, you should definitely define your own. Then we go into the scenario on page 43. I want you to read that and answer those questions. And then we'll move on. Well, actually, there's two scenarios on page 43. I want you to do both of those, and then we'll come back and we'll do exercise 5.1, and then we'll move on to the boundaries for the therapist. So we'll pause now and let you do that, and then we'll move on. Okay, so boundaries for the therapist is our next topic. You've got a case study and a scenario and exercise 5.2 to do under this section. Actually, you have a couple of case studies with this one. I want you to you should have already read the whole thing, but just know as you prepare to enter practice in massage and body work, you should consider your own comfort and professional boundaries when working with your clients. It's important to know where your boundaries lie and what to do when they are questioned or crossed. And in a situation such as Cindy experienced, the therapist had not set effective boundaries to prevent inappropriate behavior or conversation with the client. So social boundaries restrict sharing personal information or important component in any therapeutic session. Is the client paying for a massage session that includes hearing your personal problems or other personal information? Unfortunately, it's a common complaint among clients, and the massage therapist should not be talking about their own personal issues in the session. So clients generally expect a therapist to have set boundaries. They're less likely to try to test your boundaries if they know you're a professional committed to maintaining boundaries. You should always believe in your boundaries, and clients will feel your firm commitment to your profession. And be prepared for instances of intentional or unintentional boundary crossing by clients. So read those case studies, do the scenario, and do the exercise 5.2, and then we will move on to boundaries for the client, our next topic. Okay, so boundaries for the client. The client may cross a boundary with a request or behavior that is innocent or that the client knows is inappropriate. It's your job as the professional to handle the situations in an appropriate and businesslike manner. Ideally, you should be prepared to handle almost any situation that may present itself. That doesn't always work out so well, but you try to be prepared for anything, and then hopefully when a situation does arise, you're able to handle it in a professional manner. So an example of an innocent request is a client asking for advice on nutrition or to be shown strengthening exercises when you're not trained in these areas. You can have a dual certification in these areas, such as I do, but for the purpose of this course and this school, while you're in this school, it doesn't matter what your other trainings are, you stick solely to massage therapy. Then it goes on and it's talking about situations in which client deliberately inappropriate crosses a boundary. Being prepared can help you handle the situation in a professional way. Learning to say no in a professional yet firm way is important skill to manage a client who asks you to cross a boundary. The professional way to address the situation is to explain that the requested action or information is not within your scope of practice or would violate state laws, regulations, or your own practice policies. If they persist, you need to end the session or never make an appointment in the first place if the client requests it in an advanced situation. You have the right to refuse to treat a client for just and reasonable cause. And if you're unsure how to cope with a client crossing boundaries in your practice, and you want to keep the client, it's appropriate to consult with a mentor or teacher and ask for advice. Again, in our situation with the school setting, we do discuss clients between each other and between staff and students in the classroom setting, but you do not discuss it outside of that. And you discuss it in a group setting or specifically with me or with clinic supervisor, which is Nikki, and not necessarily with the other students. But from time to time we do discuss clients in class amongst the whole group, and we're okay on that just simply because of the fact that we are a school. But typically you never mention a client's name or any kind of identification or identifying factors for that client. You always keep them anonymous. So a client may cross a boundary with a request or behavior that's innocent or the client knows is inappropriate. Your job as a professional is to handle both situations in an appropriate business-like manner or professional manner. So we're going to let you do exercise 5-3. And then we will move on. Key points before we do 5-3. Clients generally expect the therapist to have set boundaries. The clients are less likely to try to test your boundaries if they know you're professional and you're committed to your boundaries. Believe in your boundaries, and clients will feel your firm commitment. We talked about that just a second ago. Actually, I think we're a slide behind on that one. And then be prepared for instances of intentional or unintentional boundary crossing by clients. So we'll pause, let you do exercise 5-3, and we'll come back and we'll talk about the consensus between therapist and client. Okay. So it's important for the therapist and the client to reach an understanding of each other's expectations for the therapeutic relationship. Each party begins this relationship with expectations, and unless they communicate to each other the expectations, it may be more difficult for the relationship to be successful. So effective communication should begin with a first phone call to make an appointment and should continue throughout each session. When a potential client calls to make an appointment, the person is, in a sense, checking out to see if you will give treatment he or she is seeking. They want to feel safe. If you say anything that makes them feel uncomfortable, they may not schedule the appointment, or if they do schedule, they may not even show up. So an example, if a potential client asks what clothing is worn during a session, and the therapist simply answers that standard policy is to remove all clothes, this can make the person feel very uncomfortable, obviously. A better answer would be that clients are encouraged to disrobe only as much as they're comfortable with, and that draping is used throughout the session to keep them feeling safe and comfortable. And we do emphasize that draping is mandatory. During the intake process, also try to identify any fears or concerns the client may have. A lot of times they'll kind of, their body language kind of gives you some hints of what's going on. If a client seems to have concerns after you've answered all their questions with full explanations, ask them if they still have concerns. Be gentle and open in your conversation. And although this verbal communication is very important, physical communication that occurs during a session is one of the most important aspects of the relationship. You're being trained to receive messages, not receive massages, to receive messages from your client's physical body so that you can most effectively treat the body. These physical messages tell you sorry, that doesn't make sense. These physical messages tell you about our problems, about the problems, I assume, such as adhesions, spasms, trigger points, and scar tissues. Clients may not be aware of problems. Likewise, clients may not realize that their bodies are reacting physically to emotions and feelings from the past, or that they feel now during the bodywork session. For example, it gives a client has an area of injury from a minor fall. You may find some adhesions or restrictions in that area that may effectively be treated by different forms of bodywork. But if that minor fall is associated with some type of emotional pain, the client's emotional reaction may be much more significant than the physical trauma. And we talk a lot about emotional releases and stuff later on, and I don't want to go too much into it right now, but just note that clients may not feel comfortable discussing an issue with you that may be revealed during a bodywork session. And it gives the example: you're working on their shoulder, you feel the client tensing up and pulling away while you work. You check your pressure and pain levels with the client and make sure that you're not hurting the client. If the client says the pressure is fine and the pain is not significant, there could be an emotional reason why the client's responding while they're pulling away. The client may not even realize that they're actually doing it, so asking them if they feel any discomfort is appropriate, but it would not be appropriate to ask more questions in depth about why they seem to be responding emotionally. Verbal and nonverbal communication should be an ongoing process with your clients. Communication needs are unique for each client and every session. So even if you have the same client every week, just note that communication needs to be going on throughout every session, regardless of how long they've been a client or whatever is the situation. Key points: there's two forms of communication take place during a session. It's verbal and physical. Verbal is the conversation. Physical involves energy that's exchanged between client and therapist. It's crucial for a therapist to be aware of this during a session because this information can be critical for the care of the client. Make sure that you're really paying attention to your client and you know what's going on with them and you're checking in with them. How do boundaries get crossed? You can cross boundaries in multiple ways. The clients and therapists can cross boundaries in a variety of ways, and it may happen unintentionally, such as they don't understand your scope of practice. It can also be intentional, such as therapists going beyond their scope and performing techniques or procedures they've not been trained to do. Because the practice of massage and bodywork is diverse in this country, it is important to know your scope within any rules, regulations, laws, and guidelines applicable to your practice. Again, you've been required to research that, find out for yourself, versus me just telling you what you find out for yourself, and then you're responsible for maintaining that. Crossing a boundary with touch. As discussed earlier, all clients come into the therapeutic relationship with their own expectations, probably even apprehensions about what will happen during the session. A new client may have had massage sessions with another therapist and may expect you to follow a similar format. Other clients may have never received any type of body work and do not know what to expect other than they will feel psychologically and physically safe during the session. This can be a delicate topic to discuss with new clients, but it can be handled professionally throughout the intake process. Your intake form can ask what areas of their body they do or do not want worked on. Our intake forms that we use currently do have a area where they can write in any area they do not want worked on, and I always try to go back and reiterate. So you stated on your intake form you do not want work on your face, or you do not want work on your glutes, because sometimes they kind of mix it up and they think you're asking where they do want work. So always be sure and clarify that with the client. As you train in body work, you naturally let go of some of your own inhibitions as you realize the need to work on parts of the body that some people are sensitive about. So again, make sure you're communicating with your client and you're aware of what areas they want worked or not worked, and make sure you explain to clients the the process of massage and why we work certain areas and why we don't work certain areas if needed. A client too can cross a touch boundary. A client may inappropriately touch, a client may cross a touch boundary. They might touch the therapist in a way that's not appropriate for the therapeutic relationship. This can be very surprising when it happens, in which case it's important to consider whether it was purposely done or if it was just an accident or, just kind of that client's behavior. But it's very important whenever a client touches you to stay strong with your with your boundaries and make sure they know that that is not acceptable. Excuse me. Okay, you've got a case study at the bottom of page 49. And then we talk about crossing boundaries with words. Excuse me. So, how and what you say during your career as a body worker can have a profound effect on your success. You've likely noticed how people take interest when talking about your new career. Many people are keenly interested in this field and want to understand more about it. That's in part why it's important to choose your words carefully when talking about massage so that friends, family, and potential clients see that you work with professional parameters. Remember that some people still feel massage involves some sort of sexual overtones. So some students react with anger when hearing such comments, while others say nothing at all. It may be better to consider this an opportunity to educate someone who has mistaken impression about what massage is or is not. Talk to the person in a calm, effective way. Avoid becoming defensive, and find a way to guide the person to a new thought process. What you say can have a tremendous effect on what people think. Learning how to approach people with a variety of different ideas is an important skill in our profession. And again, you have another case study. The clients expect you to be the expert and often look to you for advice. So always think about what you are saying to a client and be careful to stay within your scope of practice. Giving advice on topics in which you've not been trained is inappropriate. Even simple things like telling a joke may be inappropriate if the client may misinterpret it or find the joke offensive. So a joke involving any aspect of sexuality may make a client feel uncomfortable or may make a therapist feel uncomfortable if it's the other way around. So always consider what you're saying before you say it and be responsible to maintaining the therapeutic relationship. Okay, crossing a boundary with nonverbal communication. So nonverbal communication scares many, but it's discussed by few. It can cause more problems than many other issues discussed so far. Nonverbal communication may involve a simple look, a smile, or even a touch that's intended or perceived differently by the therapist and the client. Clients look to their therapist for relief from pain and stress. So many clients really like and appreciate their therapist and look forward to their sessions. But if a therapist smiles at a client or gives a casual hug, the client may feel the therapist is flirting, so be really cautious about that. Another potential problem is touching the client in a way the client may perceive as something other than a massage technique. Clients receive therapeutic effects of massage, but allowing a massage to mean something else is dangerous. For example, you feel a client is very good looking and you are thinking about that during the massage session. Your thoughts can influence how you touch the client, who may then feel the massage is taking a more seductive feel. Massage and body work involve energy exchange between two people, and the energy from your thoughts too can be transferred to another person. So you want to keep your thoughts pure, keep your intent very clear. Remember, this is a medical profession, not a sexual one. You want to consider different ways clients can feel your touch while you're giving a massage. They feel your emotional state, such as anger, complacency, impatience, sexual attraction, or love. Therefore, your frame of mind during the session is just as important as the skill of your hands. Next, we talk about flexibility of boundaries. Many boundary issues involve solid rules that should be followed in the bodywork profession. But in certain aspects of the therapist-client relationship, such as the social arena, you can be somewhat more flexible in your practice. Your behavior in this respect may depend on the individual client. When you see clients regularly, it's good to show an interest in their lives, but when the social aspect of the relationship starts taking time or energy away from the sessions, it becomes necessary to draw the line. It's not difficult to casually step back into the therapeutic role by simply saying that you need to focus on what is going on physically with the client's body. Remember that it's your responsibility to make the therapeutic relationship work for both of you, so find a comfortable way to do your work so that clients leave session feeling their needs have been met. At any time during the session, if you lose your focus on the session and the work you're doing, it's a sign that the therapeutic relationship is at risk. So you want to refocus the client on the work that you're doing by asking appropriate questions about their reaction to the massage. Says client persists with social comments or questions, simply saying something like, "Let's concentrate on this shoulder right now," or "Tell me what you're doing at work that causes your lower back to hurt," is a way to let the client know you're trying to focus on your work. Flexibility with your clients allows you to have professional yet personable relationship. It's a very good feeling when you have clients feel right at home with sessions and leave feeling better both physically and mentally. These are a couple of little pictures or whatever, where this one, my mother-in-law called again last night, and the therapist is saying, "Let's see if we can work out this tension, or work this tension out of your shoulders." You may have to help clients focus on the issues related to the massage rather than their social or emotional life. And then figure 5.2 is the therapist saying, "See you next week," and then the client saying, "I look forward to it." It's possible to have pleasant, personable relationship with clients while remaining professional. Managing crossed boundaries. Maintaining boundaries in the bodywork profession is a continually evolving process. Clients may also ask you to step outside of your scope of practice. You want to be cautious about that. Never step out of your scope of practice. Never give advice. Never diagnose. Never prescribe. Never do any adjustments or any type of procedures that you're not trained to do. And then a brief explanation of the types of work you do would be helpful during the intake, and that kind of limits the misconception of what your scope of practice is. You've got a couple of case studies in this section. You do those. And then we move on to what can happen if boundaries are crossed. If boundaries are crossed either by you or by the client, any of the following may occur. The client may not return, and usually they don't tell you that they're not coming back or that they're uncomfortable or any boundary was crossed. They just simply stop coming. You can refuse to see the client again if boundaries are crossed to that extent. A client may file a complaint against you. You can lose your license. You can lose membership in an association, and you may gain the reputation of not being an ethical practitioner. So you really want to watch out for those boundaries and keep those intact. A couple of key points before we get to our key terms. Key points: boundaries may be crossed by the therapist or the client through touch, through words, or even nonverbal communication. Some boundaries are absolute and are not open to interpretation, such as the sexual boundaries. You never have sex with a client. You don't date a client. If you do decide you have to pursue a relationship with a client, you have to wait a minimum of 6 months after dismissing that client from your care before you can pursue that. So if a client intentionally or unintentionally crosses a boundary or asks you to do so, you must manage the situation before a problem results. So our key terms, we have boundaries. Professional boundaries, these are the limits of acceptable professional behavior. Physical boundaries, these are the physical lines or limitations in a relation to the client's body that the therapist should not cross. And we use our draping techniques as physical boundaries. You never go underneath the sheet. You never allow your hands or your fingers to go under the sheet. That's a physical line. It's a physical boundary that we do not cross. Social boundaries. This is limits for keeping the relationship with clients professional rather than social. Then we have emotional boundaries. This limits or provides limits for keeping the therapeutic session focused on the client's physical body rather than their emotions. We're here to deal with their physical ailments. We're not psychologists or psychiatrists. We don't deal with their emotional part within reason. And then sexual boundaries provides limits to prevent sexualizing any aspect of body work. Again, not stated enough, you will lose your license if you cross a sexual boundary with a client. So it's very important to know what those boundaries are. It's all boundaries, but specifically physical and sexual boundaries are protected by law, and you never cross those for any reason. So that concludes Chapter 5. So we'll move on next time to Chapter 6, which is the client and therapist relationships. And we'll talk a little more then about the relationships we have with our clients. So do your quiz and complete any assignments, such as your chapter exercises. And so I don't think we had any scenarios. We do have scenarios, yes. We have a couple of scenarios and some chapter exercises that you need to complete, and turn that in along with completing your quiz, and that will conclude Chapter 5.